Hello, we are Group 8. In this video, we will be presenting Doppler instrumentation. Our presentation will cover the basic principle and clinical application of color Doppler, pulse wave Doppler, and power Doppler ultrasound.
Doppler in ultrasound is a special technique that allows us to see and measure blood flow inside the body. So it uses a Doppler effect to detect movement of the blood cells. So what is the importance? So the importance of Doppler ultrasound is that it helps to assess the blood flow, detect blockages, narrowing of vessels, or abnormal flow patterns.
Now I'm going to explain about the color Doppler ultrasound, also known as color flow imaging, color flow Doppler, or energy Doppler. It's a specialized ultrasound technique used to assess blood flow within vessels and organs. The basic principle of color Doppler is based on the Doppler effect. This refers to the change in frequency of sound wave when they are reflected from moving objects. In this case, red blood cells. When ultrasound waves are transmitted into the body and encounter moving blood cells, the reflected wave returns to the transducer with a shift in frequency. So, if the blood is moving towards the transducer, the frequency increases. However, if the blood is moving away from the transducer, the frequency decreases. The ultrasound system processes this frequency shift and converts it into the color Doppler image represent both the direction and the relative velocity of blood flow. Typically, a standard color map is used. Red indicates the blood flow towards the transducer, while the blue indicates the blood flow away the transducer. It is important to note that the color does not represent the arteries or veins, but purely the direction of flow relative to the plot. In addition, color brightness or shade reflects the velocity of blood flow. Lighter or brighter shades indicates the higher velocities, while the darker shades indicates the slower. Ultrasound is used to assess blood flow in the carotid arteries, which supply blood to the brain. The examinations begins by confirming that the common internal and external carotid arteries are patterned, and that blood is flowing in the correct direction. Normal carotid arteries demonstrate smooth and uniform color filling within the vessel lumen, indicating normal laminar blood flow. Areas of mixed color or color aliasing indicate increased blood flow velocity, which commonly occurs at site of arterial narrowing. Color Doppler ultrasound is used to evaluate blood flow in major abdominal vessels, including the abdominal aorta, renal arteries, and portal vein. In the abdominal aorta, color Doppler is used to confirm vessel patency and assess for abnormal widening or disturbed blood flow. Turbulent or swirling color patterns within the aorta may suggest the presence of an abdominal aortic aneurysm. Reduced color filling within the vessel may indicate mural thrombus or impaired blood flow.
Pulse wave Doppler or PW Doppler works by sending out short pulses of ultrasound and then listening for the echoes that come back from a specific depth. So this allows us to measure blood flow at a set location. So the first step after using color Doppler to locate the blood vessel, we can push the pulse wave button to activate PW Doppler, which will show spectral waveform at the sample volume we want to measure. Then, when the PW Doppler is active, we can get important information on the velocity of the blood flow and the flow pattern, whether it's smooth or to PW Doppler can have a limitation called aliasing, where it happens when blood flow velocity is too high for the system to measure accurately. So this can be reduced by increasing the pulse repetition frequency or PRF, which increases the maximum velocity that can be measured.
Power Doppler is an advanced Doppler ultrasound imaging mode, also known as amplitude Doppler. Instead of measuring velocity, it displays the strength or power of the Doppler signal produced by moving blood. The signal strength is related to the number of red blood cells in motion, which allowed power Doppler to confirm the presence of blood flow even when the flow is very slow. Doppler ultrasound works by using integrated power of returning Doppler echoes. This means it represents the total energy of the moving blood rather than frequency shift. As a result, it is independent of flow velocity and the direction. The image appears as a uniform color filled within vessels, which enhance vessels' continuity and morphology. Compared to color Doppler, which provide information such as velocity and directional, power Doppler does not show direction or speed. However, it has a much higher sensitivity towards slow flow, and it's far better at detecting small vessels. This increased sensitivity comes at the cost of being more prone to motion artifacts. The power Doppler is especially useful for low velocity flow and small vessel. It can detect flow that the color Doppler may miss, particularly in organs such as kidney and thyroid. It also provides a clearer visualization of tiny tertiary vessel, improving assessment of vascular perfusion. Additionally, it's less angle dependent, except when the beam is close to 90 degrees. Despite its advantages, color Doppler has limitations. It does not provide flow direction or velocity and cannot distinguish artery from vein. It is also highly sensitive to patient and probe motion, which may produce flash artifacts that mimic blood flow.
In conclusion, the three Doppler ultrasound modes each provide different but complementary information. Color Doppler gives an overview of blood flow by showing its direction and relative speed, making it useful for quickly locating abnormal flow. However, Power Doppler is more sensitive to slow or weak blood flow and helps detect small vessels or low volume perfusion, but it does not show flow direction. Spectral Doppler provides detailed quantitative information by measuring blood flow velocity over time, which is essential for assessing the severity of vascular disease. That's all for our presentation. Thank you.